Physiotherapists. I, Dr. Sonal, on behalf of the entire Academically team, welcome you to this webinar. Here in this webinar, as I discussed, we will be discussing about the course for the physiotherapist, what are your opportunities for the overseas migration and journey. And not only physiotherapists, we have the same thing for the dentists also. So please put your hands together, and we're going to start with our presentation with a very small introduction about our organization, Academically. So guys, as you all know, Academically is headquartered in Australia. We are basically based in Sydney, and it is an edtech. And we not only cater to the dentists or the doctors or the physiotherapists, we also cater to the other healthcare professionals like pharmacists and nurses. It was basically established by our CEO, Dr. Akram, who is an educationist and a healthcare professional. Sir has got years of experience, and he has very beautifully and with a lot of effort and affection designed this particular course and designed this particular organization to help all the healthcare graduates out there who want to migrate to overseas areas and want to excel in their careers globally. Academically offers support to the healthcare professionals who wish to upscale their careers by migrating to Australia or other countries. Setting new standards by providing preparation courses for the most advanced global healthcare exams. We at Academically have a very important tagline, and that is connecting with our healthcare professionals and helping them migrate to the country wherever they have the best opportunity for. We aim at one and only thing, that no healthcare professional should be left out with the opportunities. Because the very important and the very common thing which we have seen, I'm a healthcare professional myself, I'm a dentist myself, and I'm sure the others also would be facing this. We have very less opportunities, like too less, about which we know, right? We don't get placed from our colleges, except like the other BTech graduates and all that. So there's a very limited niche for us. So this webinar and these opportunities help us to visualize and to build dreams, and would definitely inculcate in us the urge, the want to go and excel globally, right? Talking about our founder and CEO, as I mentioned, Sir is a clinical pharmacist and lecturer with over 10 years of teaching and research experience in various countries. And he himself has a very beautiful journey. I'm sure you must have seen him featuring in different social media and different digital platforms. He has himself built up and migrated to Australia from India as a global pharmacist. He has established himself. He has gone through the same struggle and journey. And that is the only reason he does not want any other healthcare professional to go through it. And he wants that everyone should get the opportunity and everyone should know whatever they want to excel in. Okay, talking about our academic heads. Our academic heads are Dr. Rini Sharma, everybody. She's an assistant academic head for medical courses. Dr. Rini serves as the assistant academic head at Academically. Ma'am brings over a decade of medical expertise to the role. Dr. Sharma holds an MBBS MD degree completed in India and an MBA from Charleston Southern University. She's a distinguished researcher, and all the content, all the courses for physiotherapy, for dental have been curated under the leadership of Dr. Rini Sharma, putting her experience and expertise in all the global healthcare professional exams. And the next one, our academic head is Dr. Alok Semwal. Sir heads the pharmacy courses basically. But yeah, today what we'll be discussing is being basically dealt with by Dr. Rini Sharma. Now, all the physiotherapists, graduates out here, and also all the dentists out here, please listen to me carefully. We are going to talk about the Australian Physiotherapy Council exam. So those of you who want to migrate to Australia, whether as a physiotherapist or a dentist, also just similar, okay? So please listen to me. How are you going to write the exam? How are you going to migrate? And how many opportunities do you have for Australia as a country to practice? So we basically have our ADC qualified faculties who teach you, who make you prepare for the written assessment of ADC. You can see your faculties around here. All of them are AFRA registered physiotherapists who are working in Australia and who have passed the APC exam and have undergone the similar journey and struggle what you guys are facing and what you guys want to. So very simple question for all the dentists and physiotherapists. Why choose Australia? Guys, Australia is the only country which gives you very easily a PR visa, as you know, permanent residence visa. Like if you talk about the other countries like UK and US, there's always a condition. There are certain conditions which you have to fulfill if you want to have a permanent residency visa. But Australia is a country where you get multiple visa offers. As I mentioned, 1,85,000 visa offers for you guys. You have 6,000 plus job vacancies over there as physiotherapists, and the salary goes up to 1 lakh Australian dollars, which is no less. Okay, so you have much more than this. These are just some pointers which we have put up. So Australia serves as a very good country if you want to practice as a physiotherapist. As you can see, we talk based on facts. Average salary, guys, how much does a physiotherapist make in Australia? It's round about $25,000 annual based on the 10,000 salary report is what you see. So it's very good salary which is offered in Australia to the physiotherapists. And as you can see, the job opportunities. So right now in Australia, you have 5,864 job opportunities if you want to practice as a physiotherapist. Similar things I'll be showing for the dentist also. Just wait for some time. We'll come to that as well. Now, simple thing to understand, what are the benefits for physiotherapists in Australia? As I mentioned, guys, you have a higher earning potential. As I told you, the annual salary go up to 1 lakh AUD. Migrating to Australia as a physiotherapist has an immensely high earning potential. You get a very good quality of life. You have been seeing, some of you, if you have been to Australia, you would know that Australia is known for its high standard of living. There's an excellent healthcare, diverse culture, and it makes an attractive destination for many people, right? You get that beautiful environment, beautiful culture. You get very good career opportunity. I'm sure all of us are sitting for the career opportunity thing. As I mentioned, there is a high demand for physiotherapists in Australia, along with the perks such as I mentioned, instant PR, instant permanent residency and work visas. You also get visiting visas very easily for Australia. Now, work-life balance, this is something which all of us dream of, right? Work-life balance. So Australia is a very good work-life balance. Their work culture is really, really good. They literally respect your work timing and your personal timing. So this can help all of you all to manage your workload and maintain a healthy lifestyle. Definitely, if you are going to work in Australia, professional development also plays a major role there, because physiotherapists in Australia, they have an access to ongoing professional development opportunities. You get access to advanced technologies and you learn certain skills and you have certain knowledge which you may have not learned in your country from where you have passed a PPT degree, right? So that is something which you come across every now and then in a day-to-day life. And yes, for your families, free education and healthcare access. So Australia is the only country which offers several perks to the residents, such as you get free education for their children, you get free healthcare access. So your family as well as you, both of you all are benefited together. Now, let's talk about the APC written assessment. So guys, if you want to travel to Australia and work as a physiotherapist over there, you will have to qualify the APC written assessment. Now, what is that? So basically, APC stands for Australian Physiotherapy Council. Okay. APC assessment and ADC, the dentists also, please listen to this carefully because ADC is similar to APC. Okay. Now, the APC is the assessment. It's the examination which is conducted by the Australian Physiotherapy Council. So basically, they want to check that you have passed a BPT degree from your own country, whichever country you are. They want to check whether you are competent enough to practice in Australia as a physiotherapist or not. And that is why they conduct this written assessment to check the competence of overseas physiotherapists, and then they grant them registration in Australia. That is the only purpose of this particular examination. Now, it's a remote center exam. Very, very, very important advantage, guys. You do not have to travel to Australia and sit for the written assessment. You can sit at your own country, in your house, and sit for the APC exam. Nothing can be bigger than this. Not even going at a center. For dentists, it's a bit different, but for the physiotherapist, it's a web-proctored exam. Sit in your house with your laptop on, and you can give your written assessment without any traveling, and nothing costs. All right. It's very simple and very convenient. Okay. You can take it anywhere, including your home country. Also, you get an opportunity to sit for the exam 4 times a year, 4 months a year. That is March, June, September, and December. So not once, not twice, not thrice, 4 times. So if you're not able to finish up in the month of March, you can again reappear in June, again in September, and there is unlimited attempts. Okay. So it's a very, very big opportunity, right? You don't get a year gap. You get 4 times opportunity in one particular year. And as I mentioned, it is a remotely supervised examination. That means any candidate from your country, suppose India, can take it from your own house. Sit and take it from your house. Eligibility, very simple. 4 years of BPT degree with internship. And once you finish up with the BPT, like in India, it happens, so you get registered with the Indian Physiotherapy Council, IAP, Indian Association of Physiotherapists. Similarly, from whichever country you are, you need to finish up your BPT degree and you need to get registered from that particular country. That means you need to be a registered physiotherapist in your country. That is the only eligibility criteria which is required to appear for the APC exam. Now, steps towards your dream. Let's talk about the simple flow chart. All right, what are the steps to get qualified as a physiotherapist there in Australia? First of all is interim certificate. All right, eligibility assessment means they will check whether your documents are authentic or not. That is called as skill assessment or eligibility assessment. All right, they'll ask your degree certificate, they'll ask your various other documents, and they'll check. And then they'll tell you that yes, your documents are authentic, you are eligible to sit for the exam. In that only the cultural safety training is done. It is basically they want to show, they want you to know the Australia culture. Very simple. Okay, so we at Academically also provide you guidance for that. So the first thing is document verification and all that. Second, you go for physiotherapy written exam. English proficiency can be taken before your exam, also can be taken after your exam. That is basically required for visa. And once your written exam is done, you can practice under the limited registration category. All right. Even if you don't complete the clinical assessment, you can go to Australia and practice under a physiotherapist as a limited registration physiotherapist. Okay. But if you finish up the clinical examination, you can practice as a proper registered physiotherapist. Okay. Now, as I mentioned, so the document verification, which I was mentioning, is basically the skill assessment. So you need to present your physiotherapy degree. Transcript is basically your mark sheet and all. Work experience if you have, your passport, your government ID proof, passport size photograph, and physiotherapy registration certificate. If you're done with English, that also you can produce. So there is nothing which you do not have. Very simple documents, just you have to submit and it has to get certified and then you can sit for the APC written assessment. Talking about the English proficiency, so for the visa requirement for all the physiotherapists and dentists, guys, it is similar. Please pay attention. You can sit for IELTS, you need an individual band score of 7. For PT, you need a PT score of 65 or higher. And for OET, a minimum score of 350 out of 500 or grade B. So any of these three, we at Academically train you for all these three. Okay. So any of these three you can take, you can finish up with this particular score and you are eligible to apply for the visa for Australia. Now, let's come to the pattern of APC exam, everybody. So basically, APC exam consists of 30 case-based scenarios. What do you mean by that? Suppose there is one particular case, okay, that there is a patient who is having this particular ailment and who has been suffering from this disease, that disease. This is a case. Below that, you get 4 questions, okay, that how will you manage this patient? This patient also has got this. One particular case-based scenario has got 4 questions. All right. So this exam basically takes place in 2 sittings. Okay. 2 hours, one sitting, break, and then 2 hours, the other sitting. So in the first sitting, you will get 15 case-based scenarios, 15 into 4, 60 MCQs, right? And similarly, in the second sitting also, you will get 15 case-based scenarios. So 15 into 4, 60. So you have total 120 MCQs for 4 hours divided into 2 sittings. And the minimum passing score is 50%. Combined both the sittings, you need to score at least 50%. So the total marks is 1000. Out of that, you have to score 500. If you score 500, you are qualified for the APC. The very important and beautiful thing is there is no negative marking. Here in India and all the competitive exams, we have negative marking, right? Also in NEET we have. But here for Australia, if you talk about dentists or you talk about physiotherapists, there is no negative marking, guys. Okay. And if you have a preparation strategy, which we follow in Academically, if you come and join us, we prepare you within 16 weeks. Within 16 weeks, basically within maximum 4 months, you will be ready to sit for the APC exam if you go through our well-curated course and program. Expression of interest, guys, as I mentioned, visas. So you are eligible for permanent visa, 189, 190 PR visa. You get all these opportunities really motivate you to move to Australia. Coming now to Academically's program highlights. Guys, we are more accustomed to student-based approach. We Academically EdTech basically aim at the student-based approach. Okay, so you have one-on-one mentoring support. You have extended access to content because we know that all the physiotherapists and dentists are working professionals. You may not be able to attend live classes. So you get similar recorded lectures. Whatever live classes there, you get recorded lectures. That is why we mention it as flexible schedule also. All right. It's not that always the classes are conducted in the evening or morning. There is a flexible schedule. Okay. We try to keep it at a one-on-one level. Instructor-led, best faculties are there for you. Also, the webinar which we are having, you get periodic webinars from the industry mentors. We invite many new guests for you all who share their experience and their struggles, and you get to learn a lot from them. We also have the feedback and assessment. So all our mocks and GAN tests are artificial intelligence based. They give you proper test reports that you practice properly and you get to know your strengths and weaknesses. Apart from this, we also help you. We give you tips on CV writing and cover letter generation. Okay, tips to guide you for CV writing and cover letter generation. And yes, placement and visa support. We can also help you to make you know the amount of jobs and the career opportunities, whatever is there. We are based a company, not a consultancy company, but yeah, definitely we would help you out if ever you would require our assistance even after the exam. Fee structure, guys. So this is the government fees for APC. English proficiency test cost you this much. Entrance certificate training is around about 1364 AUD. For written assessment, it costs 1958. Dentists, please listen carefully. The similar structure is for you as well. And for clinical assessment, it is 4263 AUD. So these are the government fees which you have to pay if you want to finish up with the APC exam. Presenting to you all our recent toppers. So right now, just 15 days back, we had the December APC exam results out, and we had many more recent toppers. So as you can see, their names are mentioned. Also, apart from them, we have many more, but we could not accommodate everybody in this. These are our toppers of December 2024 who have recently finished the APC written assessment here from Academically. Okay, so this was the APC, guys. Now so this was a similar pattern, very simple pattern. Sit for the written exam, clinical, and you go to Australia. Suppose if you don't want to go to Australia, you want to go to UK. For UK, it's HCPC registration. Now the UK people, they don't want you to sit for a written exam. They basically want you to just register yourselves to them. How do you do that? Again, it's a very simple thing. Okay, you can see United Kingdom also offers a lot of opportunities. You have so much visas, current openings, good annual salary in pounds. You get a lot of benefits if you want to practice in UK. And the eligibility is very simple, either BPT, MPT. So here what you have to do is in UK, you just have to provide the proper documents. If they see in scrutiny that the documents are correct, you just have to get registered in HCPC. HCPC is basically Healthcare Professions Council, which caters to healthcare. Physiotherapist is also there. So once you get registered as HCPC, you can go and practice in UK as a physiotherapist also. So one I mentioned about Australia, this is for UK. Okay. See, this is as follows. You have to just read and understand the standard of proficiency. There's a course information form wherein you fill all your details of your experience, of your academic details, your personal details, everything. And you pay a fees that you please check my documents. That is the scrutiny fee. If they check everything is good, then they'll send you an email that it's good to go, and you pay the registration fee and you get registered. Okay, so you are registered as a physiotherapist in United Kingdom. Now, once you are registered with United Kingdom, you can very easily get yourself registered to New Zealand, and from New Zealand to Australia. So one method to go and work as an established physiotherapist in Australia is a written exam. Suppose if you don't want to write the written exam, you have a bit of time to invest. What you will do is get registered in UK, transfer your registration to New Zealand, work for 2 years in New Zealand, and then you can transfer your registration to Australia without giving exams. So this is a very simple pathway which we at Academically also offer you. So you have two options, either going by APC or going by this particular thing, right? We also give you guidance for this particular program, guys. So as you can see, UK, New Zealand, and Australia has so many job openings and so many visa opportunities and salary opportunities. Okay, so very simple, get registered in UK. After that, submit your documents, go through the international expressway pathway of New Zealand, get registered in New Zealand, work for 2 years in New Zealand, and you can get registered in Australia through the express flyer pathway. We'll take up your questions after that. If it's going a bit confusing, not a problem. All right, so thank you so much, physiotherapists. Now, please listen to the ADC also, because you will get your physiotherapy APC thing revised again with ADC. And calling all my dental graduates, please listen to this. Now we'll be talking about Australian Dental Council, the ADC exam. As I mentioned, it is very much similar to APC, just small differences here and there. So you can see are all ADC qualified faculties. They are practicing dentists in Australia and who guide you through and throughout the process of ADC exam preparation. As I mentioned, why choose Australia? Similar to physiotherapists, you get a very good annual salary, very much job vacancies are there for dentists also. I'm a dentist myself. Guys, Australia is a very, very good country to work on if you want to practice as a clinical dentist over there. You get a lot of visa offers also. All right, so as you can see, 2,454 job opportunities. You get a salary of 185K. Very good job growth, very good job satisfaction. Benefits for dentists is similar to physiotherapists in Australia, having hiring potential, work-life balance, free education, career opportunities. Now, coming to the ADC exam. Now, guys, ADC is basically Australian Dental Council. It's a body which again assesses your competence to travel, to work as a dentist in their country. Okay, they basically check whether you're competent enough to practice as a dentist in their country or not. Okay, and clearing the ADC exam is the first step to land a dentist job in Australia. This is also very similar to APC, written exam and then practical exam. Eligibility, very simple, BDS degree, get registered with DCI or your state dental council. Okay, if from whichever country you are, that is the only criteria for sitting in the ADC exam. Now, like the physiotherapy APC exam, ADC exam is also online exam, remote proctored exam. You do not have to go to Australia. You can sit in your country and give the exam. It's just that there are certain exam centers whose name you can see. You will have to go there and you have to sit for your exam. And unlike APC, well, physiotherapists are more advantaged on this. But yeah, you also get twice an opportunity, unlike the Indian exams which you take, competitive exam. ADC takes place conducts the examination twice in a year. That's March and September. And you can see the exam dates. So this time on 18th and 19th is your ADC exam, and September it's 2nd and 3rd September. So you get the dates well in advance, 1 year or 6 months ahead. So you can prepare accordingly and sit for the ADC exam and crack it. As I mentioned, ADC exam is also divided into 2 parts, written exam and practical exams. Okay, written exam can be attended from your own country, but for the practical exam, you need to travel to Melbourne and take it from Australia. Similar to APC, initial skill assessment, document verification, written examination is what you clear. Then you go for practical examination. English proficiency is similar to APC for the visa requirements. Again, the documents are also similar. For physiotherapy, it's BPT things, and for BDS, it's BDS or MDS journey. Degree, also the MDS students, guys, you also have to first practice as a general dentist. You get the visa supports also. We can talk about this in a one-on-one level if you drop your name and your contact number in the chat box. Otherwise, the similar documents, transcript, work experience, you see so much of similarities there in the APC and ADC. All right. English proficiency requirements are also similar. Now, talking about the pattern, guys, ADC exam is a bit more lengthy than the APC exam. This is conducted on 2 days. Okay, so day 1, you have 2 hours paper first sitting, break, again 2 hours paper. Day 2, 2 hours paper, break, 2 hours paper. So total 8 hours. First sitting or in one sitting, you have 70 questions. There also you have scenario-based questions only. There'll be 1 case scenario, 4 questions below that, no negative marking. And for the duration of preparation also, you have 16 weeks. If you join academically, we prepare you within 16 weeks to sit for the ADC exam. You get the sponsored visa also as the dentist. Now, as I mentioned about the ADC preparation course by Academically, guys, our sole aim is to provide you all the necessary study material, mocks, and support to ace this exam. Join Academically. We will take you one-on-one way to the ADC written assessment preparation, and you will not feel neglected. Now, talking about the program highlights, as I mentioned, the similar things as physiotherapists, you have instructor-led and self-paced content, you get one-on-one mentoring support, free webinars with the industry-led professionals, flexible schedule, you get recorded lectures, and CV writing and visa support or assistance and tips is what we give. Talking about the fee structure, similar to APC, as you can see, initial skill assessment fees is this. ADC 1, you get to spend 2122. For PTE prep or any other English course, it's around about $300 Australian dollars, and ADC 2 exam is 4775 AUD. Now, this thing is common for all the physiotherapists and dentists. All the physiotherapists and dentists, this is something which is common. We at Academically provide you financial assistance. We provide you interest-free loans and EMIs. In association with Eduance, we provide this with 12 months easy EMI options to all your students. We definitely respect that some people may not be financially available to take the course and all that. So we help you with that as well. We've also partnered with Kuhuf Edu Fintech, which is an online platform which provides fast and easy student loans to all the students whose financial burdens weigh down their dreams of becoming registered healthcare professionals. So if you join Academically, if you want to join, these are the financial assistances which we provide. Apart from this, we also provide scholarships under the program of Academically Scholarship for Abroad program. It's very simple. Visit our website, register for the test, and everyone can take this. If you clear the test with the required result, you back the scholarship and your course cost goes down at a very low level. So please try for this if you want to join Academically. And now coming to why trust Academically, guy, we have a reputation and legacy of 1,000+ positive reviews. You can see on Google, 90% success rate. We have a very good curated content. We have a very nice faculty profile who is the correspondent exam qualified person working in that particular country. We have a very good alumni network, and we definitely deal with a personalized approach. We'll give you counseling, mentorship, and motivation. And even after this presentation and webinar, if you're not satisfied, please, we are welcoming you to visit our office here. We have our corporate office in India in Dehradun, and definitely in Australia, you know about our Sydney office. So you can visit any of our offices. We are happy to host you and give you information about the relevant field. Talking about media coverage, as you can see, we have featured in Farm Tutor, News Nation, Economic Times, News 18. Our CEO, Dr. Akram, has been featuring in Startuppedia, in various news channels, in different magazines, as you can see. He recently got also sir just got right now a prize from Hindustan Times or Economic Times, I don't remember right now, for creating a great impact on the global healthcare education. All right, so he's also featured in Zee News and Startup Rise Asia Pacific. You can find us on Google, everybody. You can see the reviews. You can see the students who have been attached with us and who have also qualified the exams from us. How have their experiences been? They have shared their experience. You'll get to know about us in more detail. Please visit our social media handle. Sir has his page in YouTube also under the name of Academically. Also Academically.MedPrep. You get the recent advances and updates of the courses which are going throughout the countries. And you can contact us on these numbers. You can see our corporate office address, our main headquarter address in Sydney. So also you can drop an email at contact@academically.com. Our counselors will attend your call and they'll be giving you free online consultation. So that's it from our end. This was the PPT. Now we'll be taking the questionnaire. All the physiotherapists and dentists, please raise your hand one by one and we will be happy to answer your questions. Thank you so much for listening to the entire PPT with so much of patience. All right, let me see how many of you have questions. Please raise your hand, guys. I'll be taking up everybody's question one by one and we shall answer you. Yes, Shivani, please unmute yourself and ask your question.
Hi, my question is like my age is 42 right now, and
to me.
Yeah, you're audible. Yeah. My age is now 42. So the writing the exam, still I have age to get the PR visa, right? It is up to 45.
Yes.
In Australia. But the second way, what you talk about, like going through UK. So if I process through that way, then I will not get PR visa later on in Australia through New Zealand, and then I'm working in 2 years New Zealand and then going to Australia. So that will be difficult for me to get the PR visa. Then the 2-year lapse already will be there. Working in New Zealand, I will be already 45 and all.
Okay, so as you mentioned, you are from physiotherapy background, right?
Yes.
Okay,
Yes.
so you can take up the APC exam, na Shivani? I gave you both the options.
No, that's what that in that case that is not possible. At that time also they will see my age was either I have worked in New Zealand and then I'm going to Australia. That time also for to see my to get the PR visa, they'll see my age. That's what I'm asking.
So as
The
you
condition will be
mentioned, there's
same.
a proper age category, right? You
Yeah.
haven't still not reached to that category. You still have time. You have 5 years, if I'm not wrong, right? So
No,
before
I'm
that,
42 already. I'm already 42. I'm going to turn 43. So already
okay,
what I'm telling.
still, as I mentioned, you get 4 times. You get 4 opportunities in 1 year to sit for the APC exam. And if you
I'm.
prepare well with academically,
Mm-hmm.
maybe you can clear it up. There was one student which I had shown you right now. One student, as I had shown you, he joined our course, and within the like for the first time he had cleared the exam. He was sincerely preparing, he was working also. So it's not something. If you have a proper guidance, clearing APC exam is not tough. Yeah, on your own it's difficult, but yeah, if you have a guidance, it's not a big thing. So you can very easily manage it.
Got it. You're this first, but my question is the second. Going to New Zealand also, they will still see the age that even going to UK and then going working in 2 years in New Zealand, but I will not get after that PR visa in Australia. That second way I'm talking. The first way I
Yeah,
understood
definitely. See, for PR, you have that category now, whether you're coming
40,
from any
45
country.
age.
Yes,
That
you're
age is
coming from any
okay.
country. If
Okay.
Australia is giving you PR, they'll be giving you on their conditions, right? That is
Huh.
special.
That is what I'm asking.
Yeah, yeah, definitely, definitely. Shiva.
Mm.
Okay. So that
Okay.
is why for
And
you, APC would be the best option.
the second question is, we
Hmm.
don't have any governing body. Like IAP is not a governing body. It is just a private Indian Association of
Hmm.
Physiotherapists, not governed by government in India. So how can registration is necessary in IAP for us? And
I
then
just give an example that it is one of the body who gives your registration. We are not only catering to Indians, we are catering to all the countries out here. I just give an example. Like
let
in
us talk.
dentistry, we have DCI, right?
Yes,
Yeah.
got it. Now let me. I will be happy to get this information from my other physiotherapist colleagues here.
Hmm.
So, like, I have done my physiotherapy from Apollo College of Physiotherapy, who come, from Andhra.
Hmm.
Like now it is, I think, Telangana. I think,
Hmm.
right.
Hmm.
So we don't need to go for any, because you have you dentist people, you have your, the government council, MCI is there. But for us, there is no council only in India. So that
But you will
Australia.
get registered, no? See,
No, it's not needed actually. That's what I want anybody to answer
but
me this question in the
it's
group.
not, no, no, I'm answering. I'm there to
Mhm.
answer.
Yeah,
Why
yeah,
anybody
please.
else will answer?
Yeah,
Okay.
please.
The first things first, there are many physiotherapists who have migrated and who have completed APC and are
Yes,
working there in Australia from academically,
yes.
right? We are catering
Okay.
to them. What they are
Mm-hmm.
asking is if they want you to sit or if you want to sit for the APC exam, you
Mm-hmm.
need to be a registered physiotherapist in your country. Even if IAP is a private body, they don't care. You are registered with one particular body in your
Okay.
country, which recognizes that you are a registered physiotherapist. That is the
Okay,
only.
so that
Okay.
is a formality I need to, till now actually I've
Yeah,
not been
yeah,
registered.
yeah.
So
They
just
want
for
to see that
formality's
you're
sake,
a registered physiotherapist
so
or not.
I need
That's
to get registered with IAP to move Australia actually.
not on any word, huh? IAP can be one of the resort, not problem. Okay.
Okay. From a state side also I can be registered from
Yeah,
my
if you're
state.
registered with the state council, that will also do. Not a problem.
That will also go with it.
Yes.
Okay.
Yes.
Thank you.
Welcome. And also, Shivani, if you want one-on-one consultations also regarding your proper case,
Yes.
entire case of yours,
Mm.
not a
Mm.
problem. You can just drop your name and your contact
I've
number and
already
we'll
given.
come and give you. You've done it?
Yes,
Okay.
yes,
They'll
thank
come.
you.
Not a problem. Okay. Thank you. All right. Next, Ilyas. Yes, please unmute yourself and ask your question.
Yes, good evening, good afternoon to everyone. My name is Dr. Elias Omar from Nairobi, Kenya. I'm a practicing dentist in Nairobi.
Okay.
I've already registered the ADC exam for the upcoming exam on March 18, 19th. So my
Okay.
question is about the practical exam.
Mm-hmm.
So kindly, I wanted you maybe to comment and acknowledge me a little bit of the practical exam, whereby if in case a student registered for the practical exam, how long? Because the practical exam, the little knowledge I know about it, it is an exam that runs for a longer period, but the individual practical day is just limited to either 2 days or 3 days. So how will the student manage to reach in Australia for the for the practical exam, and in case he or she got the visa, is it limited to a particular week or month or day? How long? What is the duration of the visa for the practical exam?
Okay.
My second question is.
Let me finish up with the first question, Ilyas. Then you can go ahead with the second.
Okay.
Right. So the first question regarding visa. So for that, first you need to clear your written assessment.
Sonal, I am here only. So
Okay, sir.
I know. Okay, मुझे आपको आंसर करना है तो मेरे को बता देना आप, ठीक है, वरना आप कंटिन्यू करो, ठीक है?
जी sir. Okay, sir.
Okay.
Okay, so Ilyas, the first question for you regarding the visa. So once you finish up with the written assessment, Ilyas, what you can do is you can go on visit visa, suppose, okay? Go for visit visa, that's for 3 months, and stay there, and you can take your assessment. So basically, as I mentioned, you get the dates for your practical examination also, okay? Very much in advance, okay, Ilyas? So, and that particular exam is conducted in 2 days. Like that is also like the written assessment only. You have to go to the ADC Council office in Melbourne, and there only they have basically 14 stations, 14 workstations and all that. It's a very long process. And they basically ask about the restorations. Like they'll be giving you dummy patients and all that, right? And they'll be asking you to perform composite restoration or amalgam restoration. Depends upon that. Okay, so if you're good in your clinicals now, if you have been handling patients and all that, you just need to know the Australian guidelines and you can go and appear for that particular examination. So you can go for the visit visa and appear. It's very simple. Okay.
Okay. Thank you. My second question is in the period of between the exam, when the student finish the exam and the result, is there any opportunity for a person to engage in a work activity or something that he can sustain himself? Is there any room for that, or it is just limited to your visa? Is just restrict you to do the exam?
Okay, so if you go as a visitor on visit visa, you definitely cannot work there, Ilyas. You're not entitled to work, right? But suppose sometimes what happens is some particular person has gone as work visa only, like under the work visa, they can definitely practice. If you finish up with their ADC 1 written assessment also, no, Ilyas, what happens is some people, they go as trainee dentists and they don't practice, but they train themselves to get to, know about the Australian standards. There are many people who have gone there and who are just, working as an assistant, as in looking after the cases and seeing how does the Australian dentist perform different case scenarios, staying there and then preparing for the exam. That can be done. But definitely, if you want to work as a dentist, you have to finish up with the entire ADC exam, written and clinical. Okay.
Okay, thank you. I have a third question, but let me give the room for the rest, then maybe I'll ask later. Thank you.
That's okay. Ilyas, you can drop, as I mentioned to Shivani also, you can drop your name and number. You've dropped, I think, I've seen. Our counselors will connect with you and they'll be guiding you. Okay, not a problem.
Okay, thank you.
Thank you. Yes, Karthikeyan, you can unmute yourself. Karthikeyan, you have raised your hand. Please unmute yourself.
Hello.
Hello. Hi, Dr. Karthikeyan.
I'm audible, ma'am.
Yeah, very much.
For ADC to practical exam, what are the procedures they will conduct us to do? It's like basic, simple procedures. They will eliminate, they will filter that candidates. Exact clear-cut idea, ma'am.
You are talking about the assessment
Practical.
about assessment or
yes,
the dates?
After initial ADC on written exams, ADC to that IELTS exam, next final practical exam.
Okay, you're talking about the practical exam. So basically,
Yep.
as I mentioned, practical exam is conducted in 2 days. Okay, you have the clinicals and then you have the proper, restorative things and all that. Okay. Now, just it's an idea as a dentist, if you could understand, they basically ask you for normal restorations, amalgam restorations, composite restorations, but you have to be very careful, right? Depending on the number of, like the type of cavity.
Yeah,
They have their guidelines. You have to go as per that. Access opening and all that, they'll not ask you for typical things, simple class 1 cavity, class 2 cavity and all that. So yeah, we can guide you in detail because right now the physiotherapists friends are also there. So it would be difficult for me to guide you one-on-one. But remember one thing, if you're good at clinicals, what you have been doing in India as a dentist, just the same thing. under the Australian guidelines is what you
But
should.
it's a general practice, not in a specific practice, yeah, ma'am.
No. You are MDS orthodontics, as I've seen, right?
Yes, ma'am. Yes,
So
ma'am.
you need to first qualify the exam as a general dentist. They won't ask you,
General.
asking you for, fixing the braces and all that. They'll not
Okay,
ask.
ma'am. Okay, ma'am.
Okay.
Thank you so much, ma'am. Okay, ma'am.
Welcome, Karthikeyan. And also, as I can see, you have dropped your number, so we can guide you one-on-one on this.
Okay, ma'am. Okay, ma'am.
Okay, Karthikeyan. Thank you. Yes, Asnar, you can unmute yourself. Asanar, Majida, please unmute yourself. Yeah.
This is regarding after the exam, APC examination. Now, do we have to go there for the practical exam immediately?
That is
Like-
up to you. Up to you.
Okay, so
It's totally up
we
to you.
can. Now, if you don't mind, like when there is no help or like a sponsors, how can we get the work with the restricted conditions or whatever? Like, if you don't have a practical exam, you have to work with the restricted conditions, no, ma'am? So how it's possible?
Okay, so Majida, what basically happens is once you finish up with your APC written assessment, you get your limited registration. You can apply for your limited registration in AFRA. AFRA is basically the board which takes care of all these things in Australia. Okay, and then they'll be giving you grade A physiotherapist worker designation, through which you can go and work under a registered physiotherapist over there. So you can work and earn. And with that money only, you can survive in Australia. And at the same time, you can prepare for the clinical exam also. And once you finish up with the clinical exam, you can independently practice as a physiotherapist over there. That's the only.
Don't mind, I don't know whether it's appropriate to ask you, will I get the job like just by searching from here?
Akram sir, if you could just answer this question, what she's asking. I don't know whether servers there visible. Okay, yeah. So Majida, very simple thing. Jobs is once you finish up now. Suppose if you're there with Academically, we'll definitely guide you how to search for that and all that. But yeah, if you see the job opportunities over here, suppose you open up LinkedIn and all that, then you can definitely do. You can definitely apply. And if this take everything in a virtual mode, you definitely can, not a problem. But before that, you have to get yourself registered in AFRA after finishing up the written assessment. Only then. Okay?
Oh, okay. Okay. Thank you. Thanks a lot.
Welcome. Okay. Anyone else? Guys, please ask your questions. I'm looking at the chat box. No queries further? Akshar, do you have any question? No? Anamika? Shivani? Shivani is done with her questions. Yes, Majida, you can keep your hand down. I think your query has been answered. Yeah. Anyone else with a question? Yes, Shivani, please go ahead. Shivani, please go ahead with your question. You've raised your hand.
Yeah, hi.
Hi.
I have question regarding the experience letter, right? Which they will be asking in document side. So they're working in a clinic, any clinics. Like I have not worked in hospital for so many years. I have worked in a hospital now for so many years. I'm only in practicing in one of the orthopedic surgeon clinic. He's having he's MS ortho. So will it be, will they consider that this experience working in here in India in clinic, or they want the hospital experience letter?
No. Any experience. You just need to get it from your employer. If they give that you have been working as a physiotherapist over there, handling cases
You're
and
getting
all.
quite what I said. Like one doctor, he is having his personal clinic and setup, and I'm working there with him in his clinic. Past,
That's what I'm saying,
10
Shivani.
plus years. Okay.
Exactly, that's what I'm saying.
Okay. So that is well that they accept it, right?
Yeah, that's what I'm saying. You just need to take it from your
Okay.
employer. If they provide you with that, it is added. It's considered. Okay.
They will come for verification. They can call them, but they can call the doctor and then they can verify. They can send a mail to that person. Like that. This is the way to verify, right?
Yeah.
Okay, okay. Thank you.
Welcome. Yes, Sylvie, you can ask a question.
Sorry, one more question. Sorry to.
One second, Shivani. 1 second. I'll come back to you. Let me just
fine.
listen to Sylvie. Yeah. Yes,
Okay,
Siddhi.
good evening, ma'am.
Good evening.
Right now, I've completed my bachelor's of physiotherapy, and right now I'm practicing in Gujarat.
Hmm.
So I am having GSCPT registered body over in Gujarat. I
Hmm.
don't have IAP. So will it work for like if I want to move to Australia after APC, my GSCPT is enough for that, or IAP is must?
No, as I mentioned, I just gave an example of IAPC. You need to be a registered physiotherapist in your country. There has to be a proper body who certifies that you are a registered physiotherapist. It could be anything. Okay?
Okay.
You understand that?
Okay.
That's what Shivani asked. So I also answered the similar way. I just give you an example. Okay?
Okay. Thank you.
Welcome. Yes, Shivani, you can just go ahead.
Yes, another thing is that I have along with me, I have my two juniors actually. Right now, they are not in this meeting, so they are working in a clinic. They're also like 7+6 year experience. Now they're working in a physiotherapy clinic here. Somebody set up the clinic, so that experience is also it will be MS ortho clinic experience. So I can understand they can calculate. बट किसी फिजियोथेरेपी क्लिनिक में वो जो काम कर रहे हैं उसको वो एक्सपीरियंस कंसिडर करेंगे क्या? बिकॉज यहाँ पे तो कोई भी ऐसा कोई भी क्लिनिक स्टार्ट कर लेते हैं. एनीबडी कैन स्टार्ट द क्लिनिक जस्ट लाइक दैट इन इंडिया. वी डोंट हैव एनी रूल एंड रेगुलेशन ऐसा. तो वो
Okay,
कैलकुलेट
Shivani, so see, actually, it's difficult to comment on something if you have not seen it through and through, right?
Mhm.
So just hypothetically commenting would be a bit difficult. You have dropped your number, right? Our counselors will get connected to you. You can just ask about all these queries to them in detail. They'll be guiding you because I
That's
need to
fine.
know about the
Yes,
details also.
this is a very lots
No?
of people are working. Yeah, I got your point. Thank you so much. They will be correcting me, and then I can ask them.
Yeah, you
Lots of
can.
lots of juniors and lots of people are working in clinic only.
Yeah, no problem, ma'am.
Mhm.
You can just connect, like they'll be calling you. The counselors will be
Okay.
connecting with you. You can ask. Okay.
Thank you. Thank you.
Welcome. Yes, Majida, go ahead.
Now, academically will be helping out and guiding us to write the APC exam. Will they do the same thing even for the practical exam as well, ma'am?
Right now, we are just catering to written exam, but yeah, our practical thing will also open up very soon. The work is almost done in that. Okay. So yeah, that's on the verge. Written exam is something which we have been doing and we are still doing and very, very successfully doing. Okay.
Okay, sure. Thank you.
Thank you. Yes, Ilyas, you can ask a question, Dr. Ilyas.
Yes, this is Elias again.
Yeah.
One more question. As a dentist, as a practicing dentist in my home country, in case I migrate to Australia, regardless of whether I've cleared part 1 exam or part 2, what are the requirements for me to do as dental assistant in Australia? What are the prerequisites for me to do dental assistant in Australia? Thank you.
Get assessment. I couldn't get you. I'm sorry, I missed it.
Work as a dental assistant.
Work as a dental assistant. Okay. So Ilyas, as a dental
Yes.
dental assessment, you have a different exam for ADC. Like ADC caters to dental assistants, dental hygienists, and general dentist. You are a BDS graduate, I suppose. So you'll be working as a general
Yes,
dentist, not as a dental assistant. But if you finish up with the ADC exam, I'm finishing up. When you finish up with ADC written exam, if you want to go there, then you can work. Not you won't be designated as dental assistant, okay, because that is a separate thing there in Australia. You would be just acting as a person who is sort of trying to understand the dental treatment modalities over there. So it's something which you are doing out of your own benefit, right? There's no designation as dental assistant. If you want to work as dental assistant, you have to qualify a different ADC exam. Okay. So you can work as a trainer. Like here in India, what happens is there are many dentists who finish up with their BDS degree and they work under the supervision of some senior to try to learn the various guidelines and cases. So you can work like that as a freelancer, but not as a proper dental assistant. Okay.
Oh, okay, thank you. So that means it is just a volunteer work.
Yes, it's a volunteer work. Correct, as you understood.
Oh, okay.
Okay.
Okay. Thank you.
Okay, thank you, doctor. Yes, who's next? Anybody else? Shivani, I guess your doubt is clear. I'm just putting it.
No, one more doubt, Sonali, because you said that 4th time we will be getting chance as a physiotherapist, like March, June, September, and one more time, I think. So
December.
Yeah, December. So, how much time period we get while filling the application form and then getting the exam date in March? How much time period is there gap?
For this March is what you're asking?
Yeah, you can say that. You can tell. You can make me understand by saying about this March. We'll understand.
Okay, very simple. See, document verification will takes time, honestly, Shivani. Okay. And talking about the exam booking, you basically have to book the exam. For this March, your exam booking ends on 21st January. So I suppose if you want to sit for the March exam, right now it would not be the right time for you because you need to clear your initial assessment also, document verification. Okay. So if you want to pursue June's exam, then that is well enough. Like you have a lot of time for that. You can do that very easily. Okay.
So now only for June also, like we can fill the
No.
form and all, and then June.
No. Right now only March is going on. Once that closes, you'll be able to apply.
Okay. Once they close March, then they will release the date for June.
Yes.
That's what I wanted to
No,
know.
they
And
have released the date. They have released the date, but
Mhm.
for the exam booking portal to open, they'll
Uh-huh.
first finish up with March 1 and then we'll shift to June. Okay.
So after we finish the March one, then they will go for our document. If
Yes.
I want to write in June, they will go for document verification.
No,
Once they
document
finish-
verification, you can start, you can begin. Exam booking is what I'm talking about, Shivani. Slot
Okay.
booking. You do slot bookings, na?
Yes,
Suppose you
yes.
want to go to watch a movie, you do slot booking, right? This particular timing. Similarly, slot booking is something which I'm talking about. Document
Okay.
verification, you can start. Okay.
I can start with the document
Yes.
verification.
Okay.
So
All
before
right.
joining a course, also we can start the document verification and then we can.
Shivani, as I mentioned, would be difficult to answer everything over here.
Okay, fine.
Let the
Okay, fine.
counselor
At least let us know about your fee structure for the APC first level exam. You are saying that.
Yeah, that's what I'm saying. That I'm not the right person. Your counselor will get to you. They'll be explaining the fee structure. Okay.
Yeah. Okay.
Okay. There was one more person. Let me take up the chat questions. Okay, Sarah, before applying for APC, is recommended to get experience for a year or two, or can just go directly? You can also go directly, Sarah, after finishing up your BPT and doing your internship. What is the fee structure of Academically? Sarah, you've dropped your name and number, no? The counselors will connect with you and they'll be explaining everything in detail, okay? Fee structure for license exam for physiotherapy student. Ramisa, if you're asking about, are you asking about the APC fees? Which I mentioned, the government fees of APC. The government fees of APC is basically for the English proficiency, you get round about 285 AUD. For interim certificate and cultural safety training, it's 1364 AUD. For written assessment, it's 1958. And for clinicals, it's 4263 AUD. Okay. Jacqueline, in case we want to go to Australia after BDS to pursue masters, do we still have to write ADC? No. ADC is only for this. For working as a dentist. Jacqueline, now I'll just tell you, so we at Academically also have a wing called Study Abroad. So those of you who want to study and pursue your masters in physiotherapy or in MBA, doing an MBA in Australia or any other country, or your MDS, then also Academically guides you for that. Okay. No problem. You can connect with the counselors. Our counselors will guide you. Okay, if you have anybody else who wants to study abroad, we also have a wing of Academically who is catering to the students who want to pursue their masters or want to study abroad. Okay. All right. So I hope, Jacqueline, your question is answered. Anyone else with a question? We'd be happy to answer your question, guys. Please go ahead. And I hope you have dropped your numbers. The counselors will connect with you. Okay. I'll wait for 1 minute more and then we shall end the meeting. In the meantime, you can raise your hand if you have any query. Okay, Louis, yes. What is the process for fresh BDS graduates for applying document verification? Is PC2 is enough for applying or compulsory degree certificate? No. Provisional certificate won't do, Louis. You need to have your compulsory degree certificate. Okay. Okay. Not provisional. After your convocation, which you get now, the final degree. Because any which ways, if you want to get registered with the State Dental Council, also they would require your final degree, right? Louis, you have to any which ways get your final certificate, final degree certificate. Okay. Not your provisional one. Okay. You're welcome, Louis. Anybody else? All right. So thank you so much, guys, for joining, and thank you so much for your questions. We were so happy to answer you. And the others who are not able to ask questions, everybody, please drop your name and number. Our team will get back to you. You'll get a proper direct counseling from our team. Okay. And I suppose this webinar was informative, and I suppose I was able to take everybody's question one by one. Thank you so much, guys, for joining. This is me, Dr. Sonal, signing off. And we at Academically would be happy to host you. And if you want to connect with us, you have your numbers and all that.